Men over 50, listen up. If you wake and the morning strength you once took for granted is quieter or absent, this is for you. You are not broken, and this is not simply inevitable. I am Dr. Anna Reynolds, board-certified urologist and clinical educator with over 18 years working with men who want to reawaken circulation, sensitivity, and confidence using safe, natural techniques. Today, I will show you 2 precise points that you can press and a simple breathing pattern that together help reestablish flow and nerve response so your mornings can feel more alive again. Before we begin, type your country and 1 word about how you feel right now. For example, Brazil, hopeful, or Canada, frustrated, so we can build this community and normalize what you are experiencing. Think of your body like an old electrical system in your home. The circuitry is there, the wires are intact, but for a while the switch stopped being used. We are not rewiring the house, we are simply learning where the switch lives and how to turn it back on gently and consistently. Stay with me through the practical steps and the short 7-day challenge, and you will have concrete tools to start reactivating circulation and confidence within days. Many men are told to accept decline as age, but research and clinical experience show vascular tone, nerve sensitivity, and the balance of nitric oxide can be influenced by posture, breathing, targeted pressure, and daily habits. I trained at a major academic center and collaborated on vascular wellness programs at institutions similar to Mayo Clinic and Cleveland Clinic. The physiology is straightforward when we use a simple analogy. Imagine a river that fed a garden. Over time, small rocks and low flow build up. 2 key things help the river return to life. 1 is gently clearing the rocks close to the source. The other is opening a sluice upstream that increases flow. The 2 points we will press act like that sluice and that clearing. I will explain the anatomy in plain language so you know why you are pressing a specific location and how the nerves, small arteries, and fascia respond. Then I will guide you through safe steps to practice at home without pills or gadgets. The problem expands beyond just age because circulation and nerve signaling depend on posture, microtension, hydration, and breathing. Often, men feel shame and withdraw. Consider Robert, age 55, who described mornings that became unpredictable and a daily dread of intimacy. Consider Alan, age 57, whose work stress tightened his lower back and slowed his walking. Their symptoms were not failures, they were signs the system needed attention. The physiology at play includes blood vessel tone in the pelvic and upper thigh region, vagal modulation from breathing, and localized nerve sensitivity along the femoral and perineal pathways. We will focus on 2 points that influence the pudendal network and the femoral flow locally. The goal is not an instant miracle, but predictable improvement you can measure as firmer morning pulses, a clearer sensation, and more reliable confidence. In the next sections, you will get step-by-step instructions, sensory cues to recognize correct activation, and stories from men who practiced these steps with measurable change. Now, we will learn the first point, which I call the root point, because it sits where the lower pelvic floor connects to proximal thigh circulation. To find it, sit comfortably on a chair with feet flat and knees apart. Locate the upper inner thigh where you can feel a gentle pulsation near the crease. The structure you are near is a collection of small vessels and sensory nerves. To activate it, follow these steps. 1. Use 3 fingers with gentle pressure, apply for 30 seconds, then release. 2. While pressing, breathe in slowly for 4 seconds, hold for 2 seconds, then exhale for 6 seconds. Free. Repeat 3 cycles, then rest. Sensory cues that you are on the right place include a faint warmth spreading along the inner thigh, a subtle increase in pulsing under your fingertips, a soft tingling near the perineum, a mild release of tension in the lower abdomen, and a clearer calm in your breathing. Here is a short, safe, technical explanation in plain terms. This is a mild manual stimulation of superficial vessels and sensory nerves that can promote local nitric oxide-mediated vasodilation and increase afferent signaling to the spinal circuits that regulate nocturnal and morning tumescence. Practice it gently. If you feel sharp pain, stop and consult your doctor. In a clinic setting, this manual technique is non-invasive and takes less than 5 minutes per side and has been observed to increase local blood flow measured by simple pulse checks. Scene 1, in clinic, demonstrates a patient interaction with expanded dialogue and sensory detail. The room smells of clean linen and a faint herbal soup. Light filters through blinds, drawing thin golden lines on the examination couch. I sit across from Mike, age 62, who shifts in the chair and rubs his hands slowly. Mike says, "I have not felt consistent morning strength for months." I reply, "You are not alone, and you are not at fault. Tell me when you first noticed this." Mike looks out the window and says, "It was gradual, and then after a cold last winter, it felt worse." I ask, "Have you felt tension in your back or any numbness in the thigh?" He answers, "Yes, sometimes in the right side, and when I walk long, it gets worse." I say, "Good, we will evaluate the pattern." Then I demonstrate the first point and guide him. We will place 3 fingers here, press gently, and breathe with me. He says, "The pressure is odd, but I feel warmth." I say, "That warmth is a good sign. Keep breathing slow and long. Now release and rest." Mike inhales and exhales with a low, audible sound. His shoulders soften and he notes a subtle pulsing. The exchange includes 5 to 7 back and forth moments to allow space for doubt, reassurance, and visible micro-changes. Sensory descriptors include the towel under his knees, the faint tick of a clock, the soft rustle of fabric as he shifts, the taste of mint from the mouthwash he used, and the steady rhythm of the breathing we follow. After a single brief session, Mike reports a small but clear increase in perceived firmness when he stood up, confirming an immediate signal change. The second point complements the first, and we call it the conduit point because it helps encourage flow along the femoral channel into the pelvis. To find it, lie supine on a firm surface with a thin pillow under your knees. With the knees slightly bent, slide your fingertips 2 to 3 centimeters medial from the midline of the upper thigh just below the inguinal fold. You will feel a soft resistance and sometimes a slow pulse. Press gently for 20 to 40 seconds with steady breathing patterns identical to the first technique. Signs of correct placement are a gentle radiating warmth toward the groin, a light loosening of tight hip flexor sensation, an audible small increase in femoral pulse if you listen with your own fingertips, a reduced tension when you take a step after the session, and a clearer mental ease that many men describe as relief. A brief technical note. The manual pressure likely influences local endothelial function and mechanoreceptor signaling, which can increase blood flow and change reflex pathways tied to genital engorgement. The duration and pressure should be moderate and tolerable, not painful. In practice, you will alternate sides and perform this sequence 3 to 5 minutes daily for 2 weeks to document pattern changes. Testimony here comes from Sam, age 60, who, while sitting at breakfast, recalled a sweetness of aroma from coffee and said after 2 weeks, his morning pulses felt firmer and walking felt lighter. The story references neighbor Peter, who cheered him on, and Anna, his wife, who noticed a return of gentle confidence in intimacy. Now we put the points into a daily routine that supports vascular health and nervous system balance. Start each morning with a 3-step routine. Step 1, hydration and breathing. Upon waking, drink a 200 to 300 milliliter glass of water to support blood volume and practice deep diaphragmatic breaths for 5 minutes, focusing on slow exhale to raise nitric oxide availability. Step 2, targeted activation. Perform the root point, then the conduit point as described, spending 3 to 5 minutes total. Step 3, gentle movement. Walk 5 to 10 minutes, focusing on upright posture and conscious foot strike. These steps support circulation, nerve sensitivity, and remove tension from pelvic muscles. Reference studies from trusted institutions show that lifestyle changes, including increased moderate walking and consistent breathing, improve vascular markers and mood. Consult resources similar to NIH guidance on vascular exercise and topiocean. Education material from high-quality clinics for general context. Deep personal backstory of the protagonist follows in 3 short paragraphs to make this relatable and human. He grew up in a small town, learning the value of steady work from his father who tinkered in a garage and taught him to respect small repairs. Early experiences with sport taught him about rhythm and breath and that body signals were messages, not failures. In his 30s, he pursued a professional path in engineering, and long hours of desk work gradually shifted his posture and energy. In his 40s, a divorce and a sedentary pattern heightened stress and reduced lively mornings. The turning point came when he realized avoidance was costing his relationships and his sense of self, and he asked for help. He started small, by walking and by practicing breathwork, and then sought guidance on specific manual techniques to encourage pelvic circulation. Now he is motivated by the vision of mornings that feel reliable again, and by the desire to be present for his partner and friends like Mark, Ellen, Luis, and Grace, who all encouraged his consistency. We must name a broader circle to normalize the experience and show community reactions. Friends and family who appear in the narrative include Maria, his wife, Tom, his coworker who brings coffee, Sarah, the physiotherapist who taught posture cues, Dr. Patel, a vascular consultant who reassured him about safety, Nurse Linda, who observed technique during a session, neighbor Paul, who joined the 7-day challenge, and Greg, who provided measurements of morning pulse. Each person offers a concrete reaction. Maria notices less avoidance and more affectionate presence. Tom comments that walking with the protagonist helped both of them feel fitter. Sarah notices reduced hip tightness on assessment. Dr. Patel confirmed there was no structural emergency and endorsed conservative measures. Nurse Linda documented small objective changes in peripheral pulse. These named reactions anchor the story in real social proof. Moments of tension appear and resolve in 2 compact scenes. Scene 1 begins with a sudden morning when the protagonist wakes and feels nothing. The internal symptom is a cold tightness, and a memory surfaces of a prior humiliating clinic visit that amplified shame. He hesitates to call Maria, fearing rejection. The decision point arrives when he chooses to practice the 2 points anyway, despite shame, and notes a faint warmth after the routine. That small sign shifts his mood and prompts a call to Tom, who responds with calm support. Scene 2 shows societal pressure and a doctor appointment that once felt rushed. He remembers a clinic room with fluorescent light and a clinician who offered pills as the only solution. The internal conflict pushes him to seek alternatives. The decision to persist with breathing, touch, and consistent walking yields incremental improvements and a growing sense of agency. Each tension moment explores symptom perception, memory that amplifies worry, and the concrete decision to apply the technique, resulting in measurable microchanges. Scene includes sensory detail, such as the cold tile under his foot, the metallic taste of worry, the rustle of a prescription bag, the warmth of a supportive hand, and the low hum of a refrigerator in the background. At roughly 1/3 into this narrative, I invite you again to participate. Pause and write in the comments where you are watching from, and 1 word about how you feel right now, for example, hopeful or frustrated. Your brief response helps others feel less isolated and allows me to select anonymous stories to share in future episodes. Now, if you are ready, we will move into the 7-day challenge, which is practical and measurable. The 7-day challenge is simple and structured. Day 1 to 3, focus on consistency. Do the 3-step morning routine and log a single number each morning, your perceived morning pulse on a scale from 1 to 10. Day 4 to 5, increase walking by 5 minutes and add a short evening breathing session. Day 6, practice both points twice that day and note changes in sensation. Day 7, reflect and share your results in the comments. Expect small wins first. For some, it will be a clearer sensation. For others, a firmer pulse or less tension in the groin. The aim is consistency, not intensity. Trackable outcomes include morning perceived firmness, a simple standing pulse check near the thigh, and subjective confidence when approaching intimacy. If you experience pain, stop and consult a clinician. Share your country and your single word so we can celebrate progress together. If you want more depth, subscribe for follow-up videos that show variations for men with hip replacements, prostate history, and medication interactions. Closing quickly with an important disclaimer. This content is educational and not a substitute for individualized medical care. Seek evaluation if you have sudden pain, bleeding, severe swelling, or other concerning symptoms. Consult your doctor before starting new routines if you have cardiovascular disease or take medications that affect blood pressure or anticoagulation. Remember, you are not broken. You are reactivating a connection that has always been present. 1 month later, the protagonist notices concrete changes. He wakes more often with a light but distinct morning pulse and a renewed curiosity about intimacy. Maria comments, "I see you looking more present and less guarded, and that matters deeply." Tom says, "Your walk looks freer, and I enjoy our mornings more." Sarah reports on a follow-up that hip flexor tone reduced and range of motion improved with the routine. The protagonist reflects that small daily investments added up and that his confidence is incremental and realistic. He notices sensory differences. The inner thigh warmth during practice is clearer, clothes feel less tight, his breath is calmer, and the home smells of coffee and lemon on weekend mornings. Friends like Paul and Greg, who joined the challenge, report similar mild improvements, and the community exchanges in comments bring reassurance that this is common and one solvable with consistent care. 3 months in, the pattern becomes more reliable. The protagonist maintains the morning ritual most days and now records steady improvements in perceived morning firmness and endurance during intimacy. Maria shares that she senses less anxiety and more playful connection. Dr. Patel confirms on review that conservative measures are reasonable and suggests continued monitoring of vascular risk factors. Nurse Linda documents a modest rise in peripheral pulse amplitude and notes that hydration and walking habits contributed. At social gatherings, Mark compliments his posture and energy, and neighbors Eva and Luis ask about the breathing technique. Sensory details include the crisp snap of leaves underfoot during longer walks, the subtle citrus of a morning drink, and the steady cadence of his breath during practice. Emotionally, he reports a shift from fear to pragmatic optimism and a willingness to discuss concerns openly rather than hide them. 6 months later, the change is durable and woven into daily life. Morning strength is more predictable for many days in a row, and the protagonist experiences improved sleep and lower daytime anxiety. Maria plans small weekend outings, and the couple rediscovers spontaneous moments of closeness. Tom now leads a neighborhood walking group, and Sarah has included the techniques in her physiotherapy program for older men. Dr. Patel and a local clinic share anonymized patient-reported outcomes showing consistent subjective improvements in a community sample who practice the routine. Friends Greg and Paul send messages of encouragement, and new participants from the comments section begin to report their first small wins. The protagonist reflects that the journey required patience and consistent practice, but rewarded him with regained agency and a quieter confidence. He thinks of the old electrical analogy and smiles, because the switch that once felt lost is now part of his daily rhythm. If you commit to 5 to 10 minutes per day, you give your body a chance to restore flow and your mind a chance to rebuild trust in a slow, progressive way. Dedicate 5 minutes a day for 7 days and return to tell us how you did in the comments. Subscribe for variations and deeper progress reports, and remember to consult your clinician if you have concerns. The age of the body does not end your vitality. It only asks that you learn where the switch is and how to turn it on again.